Dear visuals, today we'll see MPT entrance of Svnirtar 2014 question paper. So it's very essential for those participants who are going to appear the Svnirtar MPT entrance. So you should be thoroughly revise all the previous year question paper MPT entrance so that you can get overall idea how the question asked in different topics in Svnirtar entrance. So today's topic is on 2014 PGET of Svnirtar. Now comes to question. Question number 1. Skeletal muscle conditioning throughout the range can be done by options are stabilization exercise, eccentric exercise, concentric exercise, multiple angle isometric. The answer will be option D, multiple angle isometric. Right? Now come to question number 2. To avoid excessive stress on graft following anterior cruciate ligament reconstruction, registered open kinetic chain exercises are contraindicated in the range of, here the option will be option A 0 to 30 degree, option B 30 to 60 degree, option C 60 to 90 degree, option D 90 to 120 degree. The correct answer will be option A 0 to 30 degree. As you know, the main function of the anterocruciate ligament is to prevent excessive anterotranslation of tibia while knee extensions. So, if you go for the registered knee extension at the initial stage of the ACL rehab following ACL reconstructions, then it will create unwanted stress over the graft area and it may causes further injury to the newly grafted tendons. That's why it is avoided to do terminal knee extension registered exercises in the open kinetic chain at the initial phase of rehabilitation of ACL reconstruction session, right? Now comes to question number 3. All the following symptoms are not considered as red flags except in manual therapy. That means all are red flags, all are not red flags except, इसका मतलब that means यहाँ पे जितना भी क्वेश्चन ऑप्शन दिया है यहाँ पे किसी को छोड़ के बाकी सब रेड फ्लैग नहीं है. इसका मतलब आपको फाइंड आउट करना है व्हिच वन इज द रेड फ्लैग इन केस ऑफ manual therapy. So option A, persistent pain at night, pain associated with stiffness, pain after activity, and weakness with numbness. The answer will be option A, persistent pain at night. Persistent pain at night means there is some acute inflammatory cases that may be due to any pathological conditions, that may be cancer, tuberculosis, or anything else, or severe nerve irritations. In that case, manual therapy is contraindications. But except option A, other options like option B, C, and D, you can go for the manual therapy treatments or any other different physical therapy treatments, right? Now comes to question number 4. All joint exhibit capsular pattern except sacroiliac and metatarsal. Option B, metatarsal and talocrural. Option C, sacroiliac and distal tibiofibular. And option D, calcaneal and metatarsal. The answer will be option C, sacroiliac and distal tibiofibular joint, right? Then come to question number 5. Question is, on passive joint testing, resistance throw range indicates what? Options are option A, hard capsular, option B, muscle spasm, option C, soft capsular, option D, buggy. The answer will be muscle spasm. As you know, muscle spasm infill means there occur resistance throughout the range of muscles, right? But in buggy infill, what is buggy infill? There occur the some feeling like it mostly happens in the joint effusion or having swelling inside the joint. You'll feel the buggy infill. And hard capsular means this is an abnormal infill where there is an abrupt hard stop before the full normal range of motion is reached, right? And what is soft infill? Soft capsular infill means this present as a stiff leather-like resistance felt specifically at the end of the range of motions, right? So capsular infill means that of the feeling of leather-like resistance, and mostly happens at the beginning or at the end of the range of motions rather than all the way through it, right? And what is boggy infill? This is feel like a soft, spongy, or wet resistance at the end rates, which is distinctly indicates intra-articular swelling or joint fusion. So remember one thing, so that you put up for the exam point of view, muscle spasm means that occur the feeling of resistance throughout the range of motions. Soft capsular infill means that occur the leather-like infills at the beginning or at the end of the range of motions. Head capsular infill means that occur the abnormal infill where there is an abrupt head stop before the full normal range of motion, right? And boggy infill means there is a feel like a soft, spongy or wet resistance, right? It mostly are the entrance and it's mostly that means there are some intra-articular swelling or joint effusions, right? Now comes to our next questions. The chemoreceptors regulating blood pressure lie at. That means the blood pressure, the chemoreceptor regulate the blood pressures, and the question asking where does it lie? The options are pons, option B medulla, option C carotid bodies, option D aortic sphincters. The answer will be option C carotid bodies. Right? Let's see how. As you know, peripheral chemoreceptors are that monitor blood chemistry. It will help regulate both respiration and blood pressure are located in the carotid bodies. So the chemoreceptors that regulate our respiration and blood pressure are mostly located in the carotid bodies. Remember these things, right? And the aortic bodies. Okay. And here is why the other options are distinctly or incorrect based on standard anatomical definitions. No aortic sinus. The aortic sinus contains baroreceptors, which specifically monitors stress and blood pressure changes rather than chemoreceptors, right? So mostly aortic sinus senses the baroreceptors. It contains the baroreceptors, right? Not chemoreceptors. And medulla, medulla is the primary center of respirations. So medulla oblongata contains the central chemoreceptors that primarily regulate respiratory drives by sensing and changing the cerebrospinal fluid rather than peripheral blood pressure processes. Right? And how pons helps. So the pons becomes the pons houses respiratory centers that modulate the breathing patterns, but does not house the primary chemoreceptor regulating cardiovascular effects. So carotid bodies mainly contains the chemoreceptors that regulate the blood pressures. And aortic sinus, it mostly contains the baroreceptors that monitor the changes in blood pressures. And medulla is the primary center of respirations. The pons means mostly it helps to monitor the breathing patterns. Right? Now comes to our next questions. The termination criteria for graded exercise test in pulmonary disease is option A leg pain, option B total fatigue, option C cardiac ischemia, option D distinct ventilator movement. तो आंसर will be cardiac ischemia. अगर पेशेंट को cardiac ischemia फील हो रहा है, then you can stop the pulmonary graded exercise programs. You can terminate the your exercise programs in pulmonary patients, right? In the type of angina noted in coronary artery spasm is stable, unstable, silent, and presbytal. The answer will be option D, presbytal. Now see what is presbytal. Presbytal means the presbytal angina means it's unique characterized by a sudden temporary it's a sudden temporary spasm of the coronary arteries. That means in presbytal angina, there are all of sudden spasm and that lasts for temporary period of time of the coronary arteries. Unlike typical angina, it frequently happens at rest. Mostly the typical angina rest में होता है or during the early morning hours rather than being triggered by physical exertions or emotional stress. And what is stable angina? Stable angina means this is caused by fused atherosclerotic plaque and that narrow the coronary arteries. And chest pain is predictable and brought on it by physical exertion or stress than relieved by rest or nitroglycerics. Unstable angina means this is an acute coronary syndrome usually caused by a ruptured plaque with partial blood clot formations. It is unpredictable, increase in severity, occurs at rest, and is a medical emergency. What is silent angina? And this refers to myocardial ischemia that occurs without any outward symptoms of chest pain, frequently seen in patients with diabetes due to autonomic neuropathy. Right? Now, comes to the next questions. The impairment that have multiple causes is referred as composite impairment, direct impairment, disability, indirect impairment. The answer will be the composite impairment, right? Composite impairment, the impairment is having multiple causes. Let's call it the composite impairment. You know the impairment and disability definitions. Then comes to question number 10. The function of error corrections and comparator is done by cerebellum, basal ganglia, cerebrum, red nucleus. The answer will be cerebellum. Right? So now see how cerebellum helps in the center for correction and the comparator is done by the cerebellum. The cerebellum is universally recognized as the center for central comparator and error detection system on the brain of motor control, right? So here it's how it works. It receives a copy of the indented motor plan from the cerebral cortex. It receives continuous real-time proprioceptive sensory feedback from the muscles and joint regarding the actual movement being performed. It compares the intended movement with an actual movement. If a discrepancy exists, it detects the error and sends corrective signals back to the motor cortex and brainstem to adjust the movement smoothly in real times. This is how it helps as a comparator and error detectors, the cerebrals, right? Now comes to our next questions. The ability to interact with other in performance of roles in community is called as the social functions, right? It's the definition of the social functions. Then the proximal loading mechanism is absent in Symes prosthesis, option A, option B, weight relieving prosthesis, option C, CAD-CAM prosthesis, option D, PT prosthesis. The answer will be option A. That's the Symes prosthesis. You know, Symes application is the ankle disarticulations, and it mostly it bear the distal weight bearing prosthesis, but in other choices, it basically relieve the weight from the proximal part. That's why the answer will be option A, Symes prosthesis, right? Then question number 13, the environmental scanning is trained for patient having, answer will be hemianopsia. Let's see why the answer will be hemianopsia, why not others. You know, what is hemianopsia? First, you should know what is hemianopsia. So, mostly hemianopsia means following a stroke or traumatic brain injury affecting the visual pathways. A patient may lose the left or right above the visual field in both ways because they can no longer automatically see objects in that missing field. They frequently bump into doorways, miss food on half of their plates, or face severely safety risks. The scanning training teaches them to use organized, wide amplitude saccadic eye movements to actively map out and read their environment. So, in hemianopsia, the environmental scanning method is useful, right? So now comes to the next question. The amplitude of fibrillation potential in electromyography is option A 50 to 300 microvolt, option B 100 to 400 microvolt, option C 150 to 400 microvolt, option D 200 to 500 microvolt. So answer will be option A 50 to 300 microvolt, right? Now comes to question 15. The reversed effective force of the body is termed as, answer will be inertia. Right? So this is all about the question number from 1 to 15 of 2014 PGET of NPT Svnirtar examinations. So in our next video, we'll see other MCQs from this 2014 years of PGT of Svnirtar. So be tuned with us and in touch with us, and also follow us to join us in our community in order to get further videos, informative videos, for the example interview, right? So be in touch with us and be in contact with us in the WhatsApp number 95561 35584. Thank you. Good night. Bye bye.